First, want to thank Fred Slaybaugh and Texas Wesleyan for hosting us here in the Martin Center. It's such a gorgeous place, and we've done a lot of our events here in the past year. Our offices are actually across the street on Rosedale. We're working on renovating in the future space for us to be there with KRA. We've been partnering on with a lot of local news, so it's a very exciting time in the infancy of the Fort Worth Report. But I want to right away introduce Fred, who in Texas Wesleyan, so he can say a few remarks. At Wesleyan, they believe in smaller, smarter, and I can tell you, working with them, they definitely live that motto. So thank you, Fred. Appreciate it.
Thanks. We're just delighted to be able to welcome all of you here to the Paul and Judy Andrews Ballroom in the Nick and Lou Martin University Center. This University Center has been everything that we hoped it would be. One of the most important aspects of it is what's happening here this morning, bringing the community to the campus to be able to have these kinds of meetings, these kinds of conversations. So we're just delighted to be able to be here. As Chris mentioned, our slogan is smaller, smarter. That's not just our slogan, it's really who we are. And the community has really responded to that. We actually had the largest freshman class in modern history here at Texas Wesleyan this fall, 458 students who are here. I can't pass up this opportunity to say, I know we have two university football teams that are nationally ranked here in Fort Worth right now. You all know, of course, that TCU is nationally ranked in terms of NCAA, but Texas Wesleyan is also nationally ranked in the football program in the NAIA. And so we're excited about the possibility of going on to the championship tournament. Thank you all for being here for part of this. We're delighted to welcome you onto our campus, and we hope that you'll come back soon. Thanks.
Next, I want to introduce, keep the sports theme going, and introduce Mike Sanborn, who's the CEO at Baylor Scott & White. And I just learned this morning that he's a University of Kansas graduate, as I am. So it's we're really disoriented by having a good football team this year. So we usually don't talk much about being some KU until it's basketball season, and then we talk a lot about it. but Mike is and Baylor Scott & White is our presenting sponsor, and he's here as president representing the medical center. So come on up, Mike. Say a few words.
Good morning, everyone, and thanks for coming. This is an important topic, and I think there's probably many of you that would like to turn the page on this particular topic. I certainly would. I think Vinny definitely would. His life will never be the same. So I think it's interesting. March 10th is when the first patient arrived in Tarrant County and was at our hospital, and that seems like eons ago. And it's weird now because in my life, I think of things as pre-pandemic or post-pandemic, and I'm sure I've seen heads nod, so I'm thinking everybody probably does that now. It's just very strange because I always tell people, and this was a few months in, like if you would have told me that there was a thing that could have happened that would have literally changed every single thing that you do in your hospital, I would have just laughed. I mean, it's like, because none of us have ever experienced this before. And in retrospect, I think there's so many things that we could learn and have learned about this, a lot of ways to look back on this, because whether it's another, like a big mass casualty event or some other issue, there's always going to be other things that I think are going to demand our attention when we don't necessarily want to pay attention. And so I think this topic is super important. Our panel is fantastic and is really going to, I think, provide a lot of great feedback and introspection related to what we could learn. I think for me, one of the most valuable things has been all the partnerships. Every hospital in this town got together and collaborated on how to take care of patients, how to manage visitors, how to just keep our teams safe, that kind of thing. But then also just the collaboration with everybody here. You know, Vinny and I were talking sometimes 3 or 4 or 5 times a day about things, just vaccinations and all these other things. It was just crazy. But it was that collaboration, I think, that really showed a lot about. I think that's part of the reason why Fort Worth handled a lot of this so well. So that's it. I'll turn it back over to you. So thanks for having us.
We also want to thank our other sponsors, our series sponsor, North Texas Community Foundation and Southside Bank, and our silver sponsors, JPS Foundation and the Real Estate Council of Greater Fort Worth. And thank you to our supporting sponsor, Fidelity Investments. All our sponsors make this possible, right? I mean, we really believe in helping to educate the community and making it accessible for everyone. All of our journalism is free, and the events are free. They're not free to produce, though. So it's because of sponsors like you that make this happen. And then I want to introduce our moderator, Alexis Allison. Before joining the Fort Worth Report as a health reporter, Alexis earned a bachelor's in creative writing at Pepperdine University and a master's in data journalism at the Missouri School of Journalism. So you can see it's sort of a left brain, right brain thing she got going on there. But her most formative education, she says, took place in China and Iraq. After living abroad, she also taught high school English in Los Angeles. So she's had quite the background. Her reporting is trauma-informed, transparent, and trustworthy. Please help me welcome Alexis Allison.
Good morning. Happy Wednesday. Thank you for braving the cold and the just early morningness of this time to be here with me today. I'm told that we ran out of caffeinated coffee, so some of us are just running on passion this morning. As Chris said, my name is Alexis Allison. I cover health for the Fort Worth Report, and today's panel is what we've learned specifically about health communication from the COVID-19 pandemic. I'd like to introduce our panelists, and I'll start right to my immediate right. We have Becky Moreno, who is a community health worker who does case management for recently discharged patients through the Baylor Scott and White Hospital system. Ms. Moreno loves animals and owns 3 rescue dogs, and I'm told they struggled to leave her this morning. So welcome, Ms. Moreno. We have Diana Cervantes. She's the director of the Master of Public Health in Epidemiology program at the University of North Texas Health Science Center. As an epidemiologist, she's navigated a lot of different scenarios, including bioterrorism agents like anthrax, healthcare acquired infections at hospitals, and infectious diseases like mumps and West Nile. And she's also known in some circles as Dr. Microbe, Dr. Diana Cervantes. To her right is Vinny Taneja, the director of Tarrant County Public Health. In his more than 2 decades of public health experience, he has also overseen response efforts for an assortment of diseases. Ebola, I believe he started in September 2014 at Tarrant County, which was the same month that Ebola had an outbreak in Dallas. So do you remember that? Zika, monkeypox, and of course COVID-19. And my understanding is that one of his first assignments was delivering polio vaccines door to door in India. So welcome, Mr. Taneja. And then finally, last but not least, we have Mary Robinson, who is the Chief Nursing Officer for Texas Health Resources. During the pandemic, she helped guide the hospital system's guidance on decisions related to clinical care, PPE, vaccine requirements, and communication with patients. She also jogs for fun. Did you jog this morning? You did not. Well, welcome, Dr. Robinson. Thank you so much. A couple of quick housekeeping notes. First, on your table or from my managing editor, Thomas Martinez, you should have comment cards. If you have a question during this panel, you can write a question on the comment card. He'll collect them around 8:30 and deliver them to me, and if we have time, I will get to those questions for our panelists. And then I've also told the panelists that this is a conversation, so I have specific questions for people, but if you want to jump in at any time, that's allowed and welcome. Okay, so let's begin. My first question is for everyone, and Mr. Taneja, I'd like you to start. Very hard-hitting question. How are you doing? Each of you have been on the front lines of the pandemic response for the past 3 years, and I'm wondering how are you faring? How has this pandemic affected you as a human?
Yeah, so a lot of people ask that question, and the honest answer is surviving, right? I mean, I joke with folks, I must have super glue in my seat, I'm still here. You know, it's been one of those for a lot of people in public health and healthcare. We're trying to make sure we get to the other side and get our community to the other side of this pandemic. And, you know, a lot of folks tell me, oh, it's never going to end, it's never going to end. Well, you know, COVID may not end, it may stay with us, but the pandemics do end, right? I mean, so we're gonna get out of this. I wanna leave you guys with that hope this morning that we will get out of a pandemic and we will survive. So that's my goal, that's what I'm doing, surviving.
Thank you. Dr. Robinson?
Thank you. Okay. Well, I think personally is one answer, but related to my job, I think I want to share with you that it's been incredibly difficult for our frontline caregivers, and Baylor Scott and White, Janice is their chief nursing officer, and she and I have collaborated throughout this. And I don't think people realize how hard it was for our teams. I get emotional because they watch people die, and it's hard. So we're dealing with the changes that happened to our teams. We lost caregivers to COVID, but we also lost them from the field. And so I think the mental health issues that have occurred in our community are obviously occurring in our healthcare team, and we're all working really hard to take care of each other and make sure we have resources to help people on the other side. So I know that's super important. It's going to continue to be important. It might never go away for the people that were involved. So they do have PTSD. So I don't think people know. I mean, when you talk about how it was tough. You're used to taking care of people and helping them get better. And let me tell you, when you put them on the ventilator the first time around, you knew they didn't have a chance. So, very few. So, it's hard, but you know what? We're a great team, and everybody locked hands together, and we're going to continue to get better and get through this, and we've definitely learned our lessons, but it's been hard.
Thank you for sharing. Ms. Moreno?
Good morning. What I've learned from the pandemic was that this pandemic turned the nation upside down, definitely. And there was a lot of fear, but we at Baylor Hospital, we were able to take care of our patients, to help them stay focused, to try to protect themselves, try to get them to get vaccinated, if not only for themselves, for their families, for their community. We did have a lot of patients that lost family members or friends, and they had a lot of questions that we were all trying to learn as we were going through this pandemic. But at the end, I think it brought the community together, and it helped us stay focused, and Baylor continues to take care of our patients and make sure that safety is first, not only for the staff members, but for our community as well as our patients. Thank you.
Dr. Cervantes.
Well, so for me, it was a unique and different situation because I worked in the front line. I did work at Baylor Scott and White under Mr. Sanborn. I also worked at Tarrant County Public Health. And having that perspective, having worked in healthcare, having worked in the public health front lines, and now working in academia, working at UNT Health Science Center Fort Worth, I think I was able to help bring that understanding as much as I could, that perspective on what public health was going through, what healthcares were working through, and trying to communicate with the general public when I would go out to communicate with the media. So I think, I was fortunate in that I wasn't on the front lines doing healthcare, I wasn't on the front lines doing public health work, but I was fortunate to be able to, in a way, fill the gaps of their stories because they were on the front line. They were so busy doing the day-to-day things and trying to support the work that they were doing and have people understand, get a glimpse of what it was that they were going through. And how both public health and healthcare do have to collaborate and work together to make sure that they're providing exceptional patient care and at the same time safeguarding the public health community. So I think that, it was for me a different role that I played, but one that I hope was able to be supportive of the work that is done on the front lines.
Thank you for sharing, each of you. Mr. Taneja, this is a question for you. In August, the director of the CDC chastised her own agency's handling of the pandemic, and she specifically said that a priority going forward is going to be that the agency deliver clear, concise, layperson-friendly messages in the next crisis. So could you candidly assess Tarrant County Public Health? How did you approach, or how have you approached health messaging in the pandemic? What's worked, what hasn't worked?
Yeah, so, our approach has been really trying to, translate the science into easy to understand language. Some of that can be hard because there's so much information coming at a fast and furious pace. Even I get chastised by our leadership. Vinny, we ask you a simple question and you give us like a long list of things. And there's a balance, but it's really, really hard. Brand new virus, you got like tons of information and then you get like 30 seconds to answer. Sometimes that can be hard, so work with us, folks. Give us a little bit to explain because the risk of not telling you everything is very high. So early on in the pandemic, the question about masks came. And what people remember and what people till this day blame public health for. Oh, y'all said masks don't work, don't wear it. That's why I'm not gonna wear it. No, what we were saying were N95 masks are in short supply. People were buying everything from Walmart, Home Depot, woodworking masks. They were buying everything up. Healthcare people who were in the hospitals dealing with the early handful of cases could not find PPE. Leave it alone from them. In the public, you don't have a big risk right now. Let the supply pick up and then wear masks. That message got lost, right? Because you're supposed to boil it down to talking points. Don't wear a mask. Okay. Then they say, well, you changed your tune and now you're saying masks work, you should wear them. Yeah, the time was different. We had widespread cases in the community. Masks were in ample supply. Yes, wear it. So that's the reason why sometimes you have to get in detail and the messaging can get confusing. It's kind of like you watch, medication ads on TV, and they'll say, oh, this is great medicine. It will fix all this, and then they run through a 30-second fast, but you need to talk to your doctor because you're going to have these side effects. Make sure you're educated. It's that, right? So that nobody can say, well, you never told us, and now you're to blame. So it's really hard. I agree that, all of us could have done better health communication and better messaging, but you got to kind of give us a little bit of that breathing room to explain these things because it's new. When it comes down to standard things that we've talked about for years, like the flu, take your flu shot, stay home when you're sick. Those messages you can boil down to 3 talking points, and most of that works and people understand, right? But when it's something brand new, give us a little bit of time to explain what it is, what you need to do, and then, come back to us and say, okay, I got that. Now give me some 2 or 3 key points that I need to do.
Thank you for sharing. I'm curious, looking back now, what's something that you might have done differently when it comes to communication?
I guess, at the end of every conversation, boil it down to maybe 3 key talking points. We try doing that, but sometimes we miss out.
Thank you. The next question is for Dr. Cervantes. So on Sunday, September 18th, the US President, Joe Biden, said in a 60 Minutes interview that the pandemic is over. First of all, is it?
So it depends on what you think
of and how you define over. I mean, I think it's over in terms of, are we, we're at a point where we do have great treatments. We are at the point where we have great vaccines, and we're at the point where people do understand a lot about the virus. And so in that sense, yeah, we're now, we have the right tools to be able to move forward and help people so that they are preventing infections and we are reducing morbidity and mortality. So in that case, yes, but this is not just for COVID, but for other things, there's always going to be that lingering of how can we do better to make sure we are communicating that information, we're getting that information to providers. So for example, I work a lot with the aging population, the elderly, and I was speaking with somebody and she told me, she's elderly, she's 75, her and her husband, and she's told me, she's like, she called me, she said, hey, I just wanted to let you know, we were diagnosed with, my husband and I were diagnosed with COVID, we feel okay, but we just wanted to let you know, and I had gone to their house previously. And I said, okay, well, did you start on Paxlovid? Did you start on antivirals? You are at high risk. Her husband has underlying conditions. And she said, well, no, the doctor said we're just gonna wait to see how things, pan out before we start on anything. So, as an educator and working with, students, pre-med students, and working with providers, I think, that these are the opportunities. This is kind of where we are. We have these tools, and how can we make sure we do disseminate and get that information in the right way? And I think when I think of, when I'm teaching my students and I'm thinking about, my time and my experience working in healthcare and working in public health, I always think that when we're putting out our message when it comes to communicating about any disease, about COVID, anything like the situation, this is, people think, well, these things, these situations it's about just the data, and it's about the science, and it's about medicine, and it should be simple. But, we do know that it's very charged with opinion and emotion, and that's just that's the landscape that we're working in. And so when we're thinking about how we can best communicate our message, we really have to think of, what are the components, what are a few components that really make up this landscape where we are putting out our message. And I think the first is that we have to consider that, people don't just make health decisions based on health literacy. So the way their understanding of information you give them, it's about, they also take into consideration their values and how they're going to put this into the context to make their decisions. And so when I hear like Biden said, well, the pandemic's over, when people hear this, they do filter that through their own lens of what they know about the pandemic, the science, but also the values. And then also another very important of public health is that it's always a balance between our individual rights and doing the overall best, the greater good for the public's health. And that's always a constant balance all of the time. And so when he says, oh, well, it's over, it's like, okay, well, we have to strike that balance. How can we make sure we are protecting the greater good of the public, but also making sure people do have their individual rights? And for me, a good example of that is I work with nursing homes, and I do a lot of infection control in nursing homes and give consultation to nursing homes on that. And there's been a big push in nursing homes, okay, wear your mask, wear all of this PPE, which is, in the bigger picture, the greater good for people, residents there. But also, on the other side, it does infringe upon a resident's individual rights to be able to communicate with their families, to be able to have, many residents, they rely on either reading lips or being able to see their people's faces and expressions to understand what's being said. And so when now that CDC has said, maybe, visitors don't have to wear masks if our COVID levels are low. Well, that really does help protect those rights of those residents. And so again, it's a constant balance.
Thank you for bringing up that tension. I feel like that will be at the heart of this whole discussion. Dr. Robinson, a question for you. So each year Gallup does a poll about who is the most trusted profession, and nurses have been the most trusted profession according to this Gallup poll for 20 years. I know you also mentioned just how hard it was to take care of patients in the pandemic, especially early on. We also know that nurses and some healthcare providers have also shared misinformation during the pandemic, according to a policy statement from the National Council of State Boards of Nursing. So how should we address when people that we trust, so medical providers, share misleading information, and how did you address it at Texas Health Resources?
Well, that's a loaded question. I think what we tried to do at Texas Health Resources was to come up with the messaging that we thought was the truth at that moment in time. And, you know, things changed. And even when we met, when I had town halls with our nursing staff, they were very frustrated because 2 weeks ago, the CDC said this, now they're saying this, and now we have to do that. How can we trust you? And I think our public experienced that too. So while nursing is and should be, I think, a trusted source, and that's something I'm proud of being a nurse, because probably all of you know a nurse or a caregiver of some sort of healthcare worker that you ask your personal questions to. And that's the way it is. It's always been that way. So what we want to do is give good information to our teams so that they can be at least as up-to-date and knowledgeable about the current information as possible. Now, that doesn't stop somebody from going and affiliating with their political groups, or, you know, watching something on TV or getting something on their phone and taking that information and then coming to a conclusion that they then want to share with other people. So I think that, you know, this pandemic to me has been the most unusual, because I have never seen the lack of trust and the divisiveness of our country plays out in our teams. And so, unfortunately, at the bedside, when they're taking care of you, I can promise you people are keeping patients safe. They're doing their life's best work. They're not conveying their political positions, and that's as we would expect. But when you get into conversations or when people ask you your opinion, and then you can deviate a little bit. And so I think when we were providing information to patients, I am very much hopeful that we were not giving bad information to any patients. But when someone asks me, Mary Robinson, outside of work, what I think about something, I'm gonna probably add some of those values in and things like that. So, you know, I just think, unfortunately, for whatever reason, this just got very politically charged as well. And so I think what we have to be able to do is let people ask questions, because that's how people learn and get their concerns addressed. So having call-in numbers, which we set up from the beginning for providers, but also for the public, we try to put a lot of information out in the community, partnered with public health. I think just trying to try and make sure that there is a source of truth and it's not too long or too much information. So, but I would just say that, you know, it certainly was challenging because it changed. And if you change things a lot, then people begin to not trust you. But I'm going to tell you, since our hospital in Dallas was the Ebola event, when that happened, we learned from that, because we talked to the media and then some things changed. And so Barclay Burdan, who's our leader, said at the beginning of this pandemic, I want you as the clinical leaders and this team to look at the information and make your decision as best you can, and don't use one source as the source of truth. So, and I think the collaboration that you talked about among the healthcare providers in North Texas, the CMOs were meeting, the CNOs were meeting, we were trying to have one message so that it wasn't confusing to our community. And I think that was a best practice. And we shared a lot. And so if you talk to somebody at Baylor, Scott and White, hopefully you got the same message that you got from THR. So while we're competitors, I think we collaborated really well on this front. And we can't fix, I mean, even, let me just say, like with breastfeeding, we have nurses that teach people how to breastfeed, women how to breastfeed. And we can give them a curriculum and say, this is what we want you to teach them, this is how you do it. But they've got their personal experience and they're going to bring that in. So what we really just want our staff to do is to do their best and to try not to harm people with their conversations and their discussions. So.
Thank you for answering. And I'm glad that you brought up politics. Obviously the pandemic has been shaped by politics. I'll open this up to anyone who wants to answer. we hear a lot about us and them and right and left and vaccinated, unvaccinated. How in our public health and medical messaging can we pursue commonality? Should we be pursuing commonality rather than polarization? And is there a language or a posture that actually works?
So, candid conversation this morning. It's in our blog. So when it comes to a matter of health and public health, you know, yes, we need to listen to our political leaders because they're the leaders we elected and they make policy decisions. But where is the source of truth that we really need to sort of go listen to and take their advice? That's your doctor, you know, trusted health professional in your life, or trusted institutions like your public health departments or academic institutions or hospital institutions. Again, don't go with just one source. Listen to all of the advice that they're giving you and maybe take that and vet that out with your personal physician or pharmacist, whoever you trust in your life for health decisions. Don't just listen to something on TV like, you know, it was brought up, and I've got nothing against the president. You know, pandemic's over. No. Pandemic will be over when the pandemic's over, and there will be a worldwide declaration that the pandemic's over. Let the scientists tell you when the pandemic's over. I don't disagree with him that we're in a very different spot than where we started. You know, we got all the tools that we need. We got vaccines, we got antiviral treatments, we got better health care, we got a lot of knowledge in the community. People know how to make wise decisions. So we're getting there. COVID's not disrupting us day to day like it was. We don't have to stay home for 6 weeks and all those type of things. We're way beyond that. But the actual pandemic being over, let the science tell you when the pandemic's over, right? Before we make too many declarations. And they'll get an opportunity to write that declaration, call it over, end the public health emergency. Because if the pandemic was over, my question would be, why is there a national public health emergency then extended, right? So it just got extended. And it's been happening all over the country, and in fact, a lot of places across the world. So again, the key point is, nothing against the political leadership. They're doing a great job. I mean, they got thrown into the pandemic just like the rest of us, and nobody could have predicted all the things that we would have to do. But again, if you're going to trust somebody and listen to their advice, listen to the people who study entire lives about these pandemics. They prepare for these things. They prepare for giving people healthcare advice. Make them and give them credibility in your decision making. Ultimately, it's going to be your decision what you want to do with your health. But give the right people the credence. Now you can make a choice. You can listen to Vinny on tax advice, but don't come blame me if the IRS comes after you, right? So same thing, you know, listen to the health folks on health advice. So that was kind of what I had, but I don't know if you had a different question.
Well, I'm going to pivot to Dr. Cervantes because Mr. Taneja, you just mentioned letting the science speak for itself. Dr. Cervantes, we've talked about how people tend to listen to their peers, so they may not actually be listening to the institutions. There may be medical mistrust. How can you tell us more about listening to the peers and what that means for public health communication? And then we'll swing to Ms. Moreno.
Yeah, so as I mentioned before, you know, people, and I think back on all of my experiences I've had when speaking, you know, when I worked in public health, and I would, you know, we did have outbreaks and we would speak to people, and we were, really our job was to try to get them to implement certain prevention control measures. And, you know, when you have a situation, especially something like COVID, where you have just very little information at the very beginning, and you have to make health decisions. And as I mentioned, we make health decisions based on the science that we know, but also our values. That's how we make our decisions. And when you are in an event like COVID and you don't know so much about the science, this is where you do rely on your values, and you say, okay, well, what is it, my internal voice that tells me this is how I should lead my life, this is what I should do. And, you know, part of your values are also made up by your peers. You have shared values, and so that makes that voice even stronger. And so I think once you get in a situation where people are relying so much on their values versus the information early on, especially because, again, we just didn't know as much, it's hard to change that. It's hard to change that dynamic of, okay, we're now going to really focus on the science versus, you know, yes, your values are important and we have to weigh these things out. And, you know, when I'm teaching my students about, you know, they're going to go out to the world of public health, they're going to go out to the world of healthcare, you know, what is it that they need to consider on communicating with people? You have to think of it as, it really is a spectrum. And, you know, you're going to have those people who are always going to do what public health and your healthcare providers tell you to do. They're just going to do it. They're just that way. And then there's going to be people who are just, no way, no, they're just not going to do it. They just don't trust you. They're just not going to do it. And so you have to really focus your messaging, I think, on that, you know, that meaty middle where people are still weighing in the science with their values, and the way that you convey that information, the way you craft your message is going to be very important. So that's where kind of maybe, you know, it shifts that balance of listening to your peers versus listening to an expert. And that's not to say that the people who are, yes, we're always going to take on your recommendations, you know, you're not communicating to them, or the people who are like, no way, I'm not going to listen to you. That's a whole different dynamic that you have to approach for those communications. But you do have to know that in general, the majority of people do fit in that middle. And you have to think, how can I best convey my message where it is clear, it's simple, it's accurate and timely, but at the same time, I'm going to make sure that I'm instilling that trust. So, you know, again, by acknowledging those values, by acknowledging that there is that shift between our personal rights and the better good of public health. So that way, people are taking this in with the idea of their peers and their values and the science.
Dr. Cervantes, do you have an example from your career of a message that you felt was clear, concise, but also acknowledged values and that seemed to communicate effectively?
Yeah, I think just in general when it comes to vaccines, you know, we went through a big, you know, with the COVID vaccines, it was either you were in or you were out. And that's really not the message, right, that we want to convey. When it comes to any health decision, when it comes to anything that you are going to decide to do, you have to make sure that you're giving people those options, that you're letting them know about the science, you're letting them know about the things that, you know, you're clear and transparent about the things we do know about the vaccine and the things we don't know. There's a lot of things we don't know about how vaccines work, and there's still a lot of unknowns, and so you have to be clear with that. And I think that whenever I'm discussing with people, I know a lot of healthcare providers, I know a lot of people in public health who they chose not to get vaccinated. And so I don't believe in taking the stance of, well, then you're wrong, because that's just not going to work, right? So it's really, I think, when you're messaging with people and you're messaging with people who are healthcare providers and public health, to me, it was the approach of, with vaccines, when it came to vaccines, making sure, yeah, you understand the science, but at the same time, acknowledging the things we don't know and the things that we still have yet to know. So I think when we think of that messaging when it comes to vaccines and really making progress with it is thinking about how we can better do that. And I think especially, and I'm sure, you know, you can speak more about this, right, about when you go out to the community, you have to kind of weigh that out.
And I do want to talk to you, Ms. Moreno. As a community health worker, you are a liaison between maybe medical providers and then the community. And so I'm wondering, as part of the SEAL project, which was funded by the National Institutes of Health, Ms. Moreno went to communities to understand what was going on with their concerns with COVID-19. And so I'm wondering, what are some of the concerns that you encountered? What are some of the challenges that people were having?
Of course, some of the concerns that the community was having, we worked with a lot of the undocumented Hispanic population. And so of course for them, it was more of a language barrier. They didn't know how to go about asking questions. We would refer them to the CDC website for medical information. A lot of these, the people out there in the community, they didn't have a computer, they didn't know how to pull up a website. So it was very frustrating for them when we were trying to survey the community in specific events, and they were against getting vaccinated. And the problem with that was that they were getting a lot of misinformation, but they weren't getting it's kind of awkward, but they were getting their information from friends and family who were almost practically in the same scenario that they were. It wasn't accurate information, so they were totally against getting vaccinated. And even more so in me being Hispanic, and in the Hispanic population or Hispanic culture, there's always several families that take care of each other. They live together. So whenever one of them got COVID, it was the entire household, and that could have been anywhere, I don't know, from 5 to 10 people, maybe 12 people that were getting hit with COVID. And in their minds, they thought that as long as they got COVID, then they no longer had to get vaccinated. So there was a lot of misconception, and we were out there trying to educate them and still trying to provide resources for them, letting them know, if these are the side effects that are going on with you or a family member, you need to mask up, you need to wash your hands frequently, you need to stay hydrated, you need to isolate. And the families were like eating together, watching TV together, all in the same room, breathing the same air. So these were things that they had a very hard time adapting to, being isolated, because especially the Hispanics, they're very family oriented and they do everything together. If they go to an appointment, it's like everybody and their grandma goes to an appointment because everybody wants to know what's going on. And so being out there was, at the beginning, it was a struggle, because we would set up tables and we would provide the resources, and we would try to talk to them and approach them and ask them, have you been vaccinated? And they had like 10 different reasons as to why they chose not to get vaccinated. And so all we did out there was basically started providing Spanish resources with, stating on there some of the information that was being published by the CDC or put out on the CDC websites. And this, I guess at some point, was, after a while, started helping the community, because by the time I also worked with the Baylor, set up some COVID hubs, and we had a lot of people coming out and getting vaccinated. And this time around, the fear was still there, but not as severe. And one of the things that, when I was out there, they would ask, the first thing that they would ask was, have I been vaccinated? And I would say yes. And I think for them, that was like, okay, well, she got vaccinated and she didn't drop dead, so I guess it's okay for me to get vaccinated. But at the very beginning, the fear of not knowing the unknown, I think, was very, very hard for everybody. And now it's like, there are so many people out there in the Hispanic population that have gotten vaccinated, and they're more aware of what's going on, and they know where to go, who to ask. And one of the main things that I think that the Hispanic population did, or the Hispanic community, is they learned to trust their doctors, because before they were not trusting their doctors. They assumed that the doctors were giving them misinformation because they had friends or family members that had died. But what they didn't realize was that it was very possible that those people that did die probably had underlying illnesses that they didn't know about. And they just thought, well, they got vaccinated and they died, so I don't need to get vaccinated. So there was a lot of uncertainty, a lot of misconceptions, but I feel like now there has been more awareness, more education provided, and I think that the Hispanic population is doing a lot better from when the pandemic started.
Thank you so much. And I'm glad you brought some good news into the discussion, and I'm going to keep going on that thread. This is for you, Dr. Cervantes. So I checked, and this week, about 93% of people 65 and older in the US have received the primary series of the vaccine, according to the CDC, so 9 out of 10 people. And then about 70% of those have also received at least one booster dose. And I know that you work with the aging population, I'm wondering what role do you think public health messaging played in that high vaccination uptake, and are there any strategies that we could take and apply to other groups?
Yeah, so again, public health did, one of the things that changed, I think, initially with the public health messaging when it came to vaccines is initially it was just assumed that, oh, well, people are going to accept these vaccines like people have historically all the time. And we saw that that was not the case, right? People had a lot of questions. These were different types of vaccines. What does this mean? So, I think whenever we're thinking about what was done well with the aging population is, again, there was good information that was provided, but I think also it has to do a lot with what you think is important. When you're older, you have more of awareness of illness, and that the likelihood that you can have severe illness. And I think that when that's one thing, that the reason that we do see people who are elderly, that they're more open to getting vaccines. They've gone through health scares. They've gone through pandemics. I remember even speaking with my mom. She passed away in May, but when the pandemic came, she knew about, that wasn't the first time. That wasn't her first rodeo when it came to infectious diseases. She had been through a lot of infectious diseases, and she, polio and everything else. And so vaccines were she had witnessed throughout her whole life how important vaccines were. And so I think that had a lot to do with it, is those perceptions beforehand. But also, I think, again, one of the things that public health did in the messaging, knowing that there were going to be groups that didn't understand the vaccine or hadn't had those experiences, I think, like our aging population, is really being transparent on the science. CDC and local public health departments, they put a lot of information about, this is what we know about the vaccine. These are the components of the vaccine. There's things that we don't know exactly about the vaccines. How does this exactly work? We're not 100% sure, but this is how, we're trying to understand what's the difference between our antibodies and T cells and all of these things, trying to understand this. So they put more information out there so people would understand that. But again, being transparent about the uncertainty. And I think that goes a long way. Whenever in public health you are transparent about that uncertainty. There's things that we just don't know. And, I think when in science and public health and in medicine, sometimes uncertainty, especially if you're a scientist, it can be good. It's exciting. There's things we don't know, and we're on this road to discovery, right? We're going to get there. But the public's view uncertainty is bad because it means we just don't know things. So I think it's really important. And I think with vaccine messaging, it was, these are the things we do not know now, but this is where we're headed. This is what we're doing to get to that place. And I think it made people feel more comfortable about that uncertainty.
Yeah, Dr. Robinson.
I just want to add in that I work, Texas Health set up a number of clinics. We partnered with the public health department, and we were assigned the older population to provide that too, because these clinics were smaller and they didn't have to stand in line. But I gave a lot of shots to older people, and it was, many of them said, oh, I just can't wait to see my grandchildren again, or I can't wait to not be in my house and not see people. So there was they were accepting, like was just described, but also I think they were so driven by the time it had been without being with people, because they know their time is not that long, it's short. And so, and we designed our clinics for that population. So they sat in their cars until we needed them to come in, and then we would just bring them in and put them in their rooms. We tried to be the Chick-fil-A of vaccine distribution. So, but it was a great partnership, because then we would send their records over, and I just, of all the terrible things that were going on during the pandemic, that gave a lot of us that were working those vaccine clinics a lot of joy, because it was something we could do to make things better. And I think they wanted to do their civic part too. They wanted to, give back to their community and not be someone that's giving other people COVID.
Thank you for adding that. And I'm glad that both of you mentioned people pursuing a specific type of behavior to match their values. Behavior is interesting because we know that there is a lot of uncertainty, but we also know that some types of behavior contribute to disease. So I'm going to bring in monkeypox briefly. We know that the majority of people who are contracting monkeypox are men who have sex with men. We know when it comes to COVID, we've seen that people who don't get the vaccine are more likely to die of a COVID-associated illness than people who did get the vaccine. So how can public health officials engage and prioritize specific groups without villainizing or ostracizing them in their messaging?
Yeah, that's a very delicate balance, but again, the key there is to be transparent about the information that we know and who's getting impacted disproportionately, right? So we need to make sure that the messaging is clear for those folks. Hey, you have the highest risk, and we want you to listen and take action. So that's really what we can do and what we've been doing. Sometimes it's hard because there's so much information flow. And again, with the pandemic, I mean, y'all tell me if I'm lying. Everybody became an expert on COVID, didn't they? Everybody had an opinion. And people were very vocal about their opinions. It was really hard for people to figure out, who do I listen to? You know, I go to work and my coworker and my bosses are saying something different. I go to my doctor, they're saying do this. I listen to people on TV, they're saying do this. Then I turn on the channel, something different, and they have a different opinion. It got very, very confusing. And again, the only advice I would give people to is listen to everybody, make your health decisions, but go to a trusted person that you trusted your entire life for your health decision. Sit down with them, have a candid conversation, then make the choice.
I would just like to add too that this pandemic, it amplified the disparities that we have in healthcare. We have our Black population or Hispanic population that suffer greatly with, you know, housing issues, healthcare issues. And so I think as a community, we have to continue to figure out ways to go into those areas where their trusted source of information is. And a lot of times it's their church. So we continue to try and keep those partnerships at Texas Health Resources. We have Fed community relationships, and I know that we did that through the public health work as well. So, you know, meeting people where they live and where they experience their life is important because there's a lot of distrust. And so I think the messaging sometimes has to come from a trusted person. So using those faith community leaders, a faith community nurse if they have one in their church. So we just have to get better in general, I think, about improving the health care of those populations. And I think if we do that well, the trust will continue to grow, because we just have to remember that those parts of our community have been disenfranchised and I know that we're all trying to pay attention to that. And so I think this was a way that we could get in there eventually and do better, but we didn't do good enough.
Thank you. Anyone else? Okay, thank you so much. Mr. Sanborn mentioned this at the beginning of the conversation, but people are tired of talking about COVID-19, and yet here you all are. How do you factor in COVID fatigue when it comes to messaging? Mr. Taneja, you mentioned that we're at a different stage of the pandemic right now. So how do you factor in COVID fatigue, and what's the message that we need to be sharing right now?
Yeah, first of all, a real acknowledgement from everyone that COVID fatigue is a real thing. We're all sick and tired of it. I'm sick of talking about it, quite honestly. You know, but again, we're all adults here, right? I mean, you know, things don't happen the way we'd like them. A lot of times, that's just life. And the pandemics, they tend to drag on for a while. I mean, if history has given us any lessons, I mean, people heard about the 1918 flu pandemic, so it was 1918, right? No, it lasted till almost 1923, almost 5 years. So some of these pandemics can drag on, and the science will evolve, the messaging will evolve. All I ask is that you continue to listen to the messages and try to assimilate as much as you can into your daily, day-to-day lives. Let me give you a good example. So the messaging has changed. Oh, you don't need to wear masks, and you know, the vaccine booster is here, take if you want it, and all that. I mean, it's kind of starting to get like very diluted. But it's diluted because the assumption being made is that we've given public enough information so that they can make their right choice. But is that always reality? A lot of times people don't understand the differences on why boosters are coming out and when's a good time to take a booster, when's a good time to wear a mask, all those type of things. So let me give you a personal example. I'm still wearing a mask. Not stupid, right? You know, the reason I'm wearing a mask is because now, living in public health and living through COVID, I've gained enough knowledge. Not everybody has that luxury, but this is what I want you to listen to. I've gained enough knowledge that COVID is coming and going in waves. Right now, we're in a very low level in our community. That's great. Can I take a mask off and feel safe? Absolutely. But then I have to pepper in my personal health situation. Fine before COVID. Over the last 3 years, gained 30 pounds, ended up getting diabetes. My personal health situation changed. So now I'm at a high risk, even in a low COVID environment. Okay, so Vinny, did you take your boosters? I took the 2 primary series and a booster. New one came out, I'm waiting. Not that I'm afraid of the vaccine, we're at a low in our community. I wear a mask. I mostly go to Zoom meetings. I stay pretty much in my office, don't attend a lot of large group gatherings unless they're required. So I'm trying to time it towards the end of October, because what I've seen is vaccine immunity is good for about 3 months and then something else hits you. So at the end of October, I'm gonna time it, try to get through the winter surge, because it's coming. I'm seeing it overseas, right? You know, so UK's having it, France and Germany are having it. We're no exception. We're gonna probably see an uptick in COVID going into the holidays. So again, is everybody at that level of understanding? No. And that's where messaging becomes important. And that's where personal health decisions and personal strategy becomes important. I can't look at everybody and say, oh, you know, in your health situation, you need to do this, because we run the public health department, we put out messaging for the community. And that's where the community members need to take that messaging to their personal physician, or again, like I said, a trusted health source who understands the health and science, and make that decision. They might tell you, oh, you're young and healthy, you're fine, you can wait. Oh, no, you have rheumatoid arthritis, I'm putting you on biologics, and you have a high risk of catching any infection, take that booster now. But that's something that your physician can tell you, or a pharmacist that you work with can tell you. So again, I keep coming back to that message. Yes, we're at a different time where you can make your own choices, but put context to it. Just don't listen to some key headlines, you know, oh, well, the booster's here and it's your choice. Sort of. It's your choice because it's your personal health decision, but we're providing you the tools and giving you the education to make that right choice at the right time. And again, there's a balance between personal health and then community health. There is a civic responsibility in all of us, because what is happening is people don't realize, if a lot of people in the community say it's my personal choice, I'm not going to take the vaccine. COVID keeps circulating. Every time people end up with COVID, the virus multiplies by millions of copies. So if anybody worked in production industry, manufacturing, anything, they'll know. You go to a factory, they'll produce 1 million copies of something, and invariably there's going to be an error in production. And if the quality control people don't check it, that error in production carries on, and then you have to end up doing recalls on things because the wrong date got printed, or the die was wrong and the shape was misshapen, or whatever. That's what happens in the human body when multiple millions of copies of the virus are produced. That's where mutations occur, right? So then when mutations occur, now all of this protection that we built in the community, everybody took a vaccine, now there's a new variant, and that vaccine doesn't work. So those are the key things that people need to understand, how it keeps mutating and mutating and mutating and keeps coming back again and again, because we need to unite against the virus. You know, put our differences aside and take a united stance and say, we will not let this settle. And because it's such a large pandemic, affecting all of us across the globe, it has been really hard to put a united front against it. Different resources, different opinions, all those types of things. There are examples where we were very successful because limited number of people were impacted and we were able to take a stand. Recently, there was a Zika pandemic in 2016-17, impacted a few countries. There was a united front made by the communities that were impacted. We will not let Zika settle into our communities. We had a very robust response. General public didn't care that much because it was done by public health and governmental entities, and everything's good. And then virus mutated. And then people started saying, oh, well, but y'all lied, you said this was gonna end COVID. Yeah, but take it into context. Not everywhere in the globe people had this vaccine. And that's why virus mutated. And that's why we have new waves. And now we gotta retool ourselves to get to that point of where we're getting towards the end of COVID. So, point of all of this is, again, make sure you take your personal health decisions in context, time things, look at your personal health history, but also balance out. If you're a person who sits in the office all day and doesn't see anybody, hey, do what you need to do. But if you're out in the community, like most of us, shaking hands with people, going to group gatherings, going to holiday parties, think about yourself, but think about others that you're gonna meet as well.
Thank you, Mr. Taneja, and I have questions, but obviously we don't have time to get to them. Thank you for submitting them anyway. I'll go through them afterward. And I want to give our other three panelists a minute to share a final takeaway. What's something that you hope that people in this room take away from this time today? And Dr. Robinson, if we can start with you.
I hope that you all go out and get your boosters, because one thing we haven't talked about is the hospitals got overwhelmed because so many people were sick. So if we get another surge and a lot of people are very sick, we will run out of space in the hospitals again, and we will have people backed up in the emergency rooms. And it was hard on our staff because I couldn't understand why people wouldn't just take a vaccine so that they didn't have to take a risk of coming to the ICU and dying. I had a lot of nurses say that to me, I don't understand this. So we really, you do have your own personal choices, people have their own personal choices, but we have a duty to each other as well. And we don't have unlimited resources when it comes to healthcare facilities and hospital beds. And so I think just messaging that this is important, that we stay on top of this is what we need.
Thank you. Ms. Moreno.
I think that the takeaway would probably be that if you have friends or family members that have not been vaccinated or still are against being vaccinated, encourage them to evaluate their health. And if not for themselves, for the community or for their loved ones, to get vaccinated or to get boosted. It's important.
Thank you. And Dr. Cervantes.
I would say the big take home for me is, this is really, when we get in this point where people are like, well, the pandemic's over, this is where the real hard work begins. This is where you really have to pull up your sleeves and say, okay, well, how can we make sure that, both in academia and healthcare and public health, we're working together to make sure that we are really still doing that community work, going out to communities and understanding, what are the barriers? What are still the barriers, and how can we work to make sure that we're trying to overcome those barriers? And I'm sure Vinny knows that many times what happens in public health, you have a big event and resources and money just come pouring in, which is great. But what we really need is you need to have continuous support. Once the pandemic is over and things start coming down and the funding goes away, it really, I think we all, as a community and society, we have to advocate for public health and healthcare to make sure that it is, that the resources are level. And it's stable, so that we can continue to do that work, so that we don't keep seeing the same cycle of, okay, we get a lot of money in public health and we got to scramble to use it all up because it's use it or lose it money. And then we started doing some great work to build a foundation for doing community outreach, but then the money dries up and then the work goes to the wayside. And then something else happens and then the same cycle over and over again. So the big take home is, you know, we need to make sure that we're really supporting that work, having that stability in public health and healthcare structures.
Thank you so much for your time and insight. Let's give them a round of applause. And I'll turn it back to CEO and publisher Chris Koppler.
Thank you so much, Alexis, and to our panelists. It's such an honor to listen to brilliant people like you talk about such an important issue and the lessons we have and haven't learned from COVID. In my journalism career for 40 years now, I still every day pinch myself and think, I get paid to ask questions and learn things every day. It's really a cool job, and brings me to thanking our sponsors who make this happen, and to thank all of you, because we are a nonprofit, a nonpartisan local news organization, and we function only because of your support. So I want to encourage you to go to fortworthreport.org, sign up for our newsletter. You'll read coverage later today and tomorrow about this panel. You'll see video of this panel. We have it on our Facebook Live page right now. All that happens, again, because of your support. So while you're at fortworthreport.org, getting our newsletter, think about making a donation to large or small. We appreciate it. And we hope you'll all be back November 11th, back in this room. We have a session, a candid conversation on mental health in Tarrant County. Really important issue there as well. So we plan to be here for a long time in the community delivering these important messages. So thank you all so much.